control and final elimination of malaria has been one of the most important goals in global public health over the last few decades. And so much progress has been achieved. Countries like China and Sri Lanka have already eliminated malaria, which is a historical achievement after many years of intense investment and mobilization. Malaria elimination is a global public good. It is important for all of us. It is important for our own security. It is part of the global health and regional health security because it makes everybody more safe if we are protected from infectious diseases such as malaria, other infectious diseases, and new viral diseases such as COVID. This pandemic can potentially threaten all the progress we've made and put into question whether we can finally achieve malaria elimination. Mortality from malaria could double again to numbers that we have not seen for many years. And this would be absolutely devastating. It does impact the production and supply chain management of malaria diagnostics and therapeutics. It can affect the distribution of bed nets in the communities. It does already affect the behavior of people who might not seek treatment for malaria in case of fever because they are afraid to approach health centers and hospitals. And all predictions are that basically in all countries around the world, we will see a reduction in GDP of something around 5 to 10%, which is quite dramatic. And it will no doubt have an impact on domestic budgets, including on the health budgets and the spending on malaria control and elimination. It will most likely also have an effect on the development aid budgets, on the official development aid of many donor countries that are struggling themselves with the disease in their own countries, but also over the next few years we'll see the impact of their huge bailout packages that they have invested to keep their economy going, and that could potentially then reduce the international solidarity aspect and their generosity to fund very important causes like malaria elimination. We obviously have to maintain malaria elimination and control as a high political priority, both in affected countries and in donor countries. That we forget about many of the other diseases that are just as important or not more important than COVID-19 in terms of morbidity and mortality. So we have to kind of educate also politicians and decision makers that this is a real choice that they have to make. The investment that is required to maintain the efforts towards malaria elimination are really very small, and they are doable. It is possible to achieve that. This is not about charity. This is not about aid. This is about what we in the Job Lange Institute call a new concept of global public investments. What is required is that we all approach it in the sense of everybody contributes according to their ability, and some countries will benefit according to their needs. And I think that is particularly applicable to this question of malaria elimination. But it is absolutely important that we achieve this, that we don't stop where we are and don't lose the momentum that we have gained, because this will benefit all of us and requires all of our attention and all of our support. Thank you.